Hello nurses, this is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing and the NCLEX. Today's focus is on pulmonary lecture number 15, bronchoscopy, and this sticky note found on Nursing KAMP.com and social media. All right, let's get into it. What's a bronchoscopy? Well, a bronchoscopy is an invasive procedure that it basically puts a scope down a person's throat to visualize the lungs and the bronchial trees. And generally it's an assessment. It's an assessment to further evaluate what's going on, whether there's any tumors, inflammation, cancer, or strictures. Strictures. Can't spell today. And that's what we're doing, is you're going to put a scope down the person's throat to look at these issues. Now, patients are going to need sedation when they get this treatment or this procedure, because when you are putting a scope down a person's throat, you need to suppress that gag reflex. So that's a primary assessment, is the patient's gag reflex. So let's get into the ALEEPS. Now, ALEEPS is a method that I use in order to evaluate procedures. And procedures are basically all content areas that I need to focus on when I'm looking at studying or teaching or evaluating. All right, so let's look at the first thing. A, is it acute or chronic procedure? Well, the first thing is that it's acute. It's acute because it puts a tube down the person's throat. And they're going to need sedation, which means that if you're throwing something down the throat and they need sedation, they're at risk for aspiration. So the patient's definitely going to be NPO. And they need to be monitored post this treatment. So that's definitely acute. It's not a chronic procedure, so you would do it to evaluate specifics. And so that brings us to the next thing, this L. What is it looking for? Well, it's looking for problems in the bronchioles, problems in the throat, tumors, maybe some inflammation. And a lot of times you'll see it with patients who are just not clearing. What I mean by that means that they're just not getting better. And what happens is that they might be on a ventilator, and the patient's just not really getting better, and they don't know why. So what they do is that sometimes what they'll do is they're going to do what's called a bronchial wash. And that bronchial wash basically roto-rooters cleans out all the bronchial trees. And then they take out all the pulmonary secretions, and then they're going to send that down to the lab to be evaluated. And then they might be changing antibiotics based on that. They may also go down and they might do a biopsy, because they might be assessing, is this cancer? What's causing the inflammation down there? So that's important, because a biopsy, post-biopsy, you're going to be assessing the patient for bleeding. So hemodynamics of the patient bleeding coming out of the throat post bronchoscopy would be acute. Okay, so what's it looking for? Tumors, inflammation, cancer, and also strictures. It might be if there's food being stuck in their throat or those type of things. Are there any problems in their bronchial tree? Next thing is any labs to be associated with this. Well, prior to, you might assess the patient's CBC for bleeding, right? Do they have a normal, and platelets? The reason is because of clotting. And you also might look at the PT, PTT, and INR. And these are normal assessments, because if the risk is on a biopsy, bleeding, you'd want to make sure that you know that there's no underlying condition being going on. The next is E. Does it affect their eating? Well, yeah, they're going to be NPO prior to this procedure. They're going to be NPO 8 to 12 hours prior to the procedure. So generally, 8 to 12 hours. And then post-procedure, they will be generally NPO. And they come back, generally gag reflex will return within about 2 hours. So never ever give a patient who's post-bronchoscopy a hamburger or anything to eat or drink. And generally what we do is that once the gag reflex returns, we start with ice chips first, then to clear, and then move on. So, nursing priority is never feed the patient until you know what their gag reflex is post. All right, so assessment. Assessment before. Well, you'll need a consent. You're going to evaluate the labs like we said. And then during. Well, you're going to assess for vital signs. Because they're going to be getting sedated, we're going to assess these vital signs. And then post. MPO, until gag reflex is found. You're going to look for bleeding, any potentials of bleeding. So any bleeding out of the mouth or throat is a problem. You aren't going to feed that patient post. Any prescriptions? Well, generally, prescriptions, meds are held because MPO prior to. But follow nursing policy and procedure for your facility, because that could be different wherever you are. So it's not always absolute. Any problems, P, the next P, any problems with a bronchoscopy? Well, if it's a biopsy, bleeding would be a problem. You're sticking a tube down somebody's throat, and when you start to do that, what happens is that you can get what's called laryngospasms, which show up as stridor, and that would be acute. So if you ever have any difficulty breathing, shortness of breath, bleeding, stridor, high-pitched sounds, call the doctor, because that's acute, and the patient's having laryngeal spasms. And you give racemic epi for that. Stand out. What stands out about a bronchoscopy? Well, it's an invasive procedure that is done to evaluate the lungs for tumors, inflammation, cancer, and strictures. Also to check for biopsies to see what if there's any cancer. It's pretty invasive, so MPO is a big factor because of aspiration, and also the factor post bronchoscopy. You're going to be looking for aspiration precautions as well. And what you generally do is you'll keep that patient MPO post bronchoscopy. What else stands out about a bronchoscopy? It's acute, it's invasive, it's a big issue when you're looking at delegation and patients' education. So family members would need to be educated. You can't feed this patient afterwards. Also, LPNs, nursing assistant personnel, you might intervene if they are bringing in a dinner tray. So you're going to hold all that food post a bronchoscopy. Well, that's about it. My name is Kamp, and this is Nursing Kamp. That's a general overview on bronchoscopy, and we'll see you next time.